Good afternoon. I am Dr. Joss Reimer, medical lead for the Vaccine Implementation Task Force. I'm joined by Johanu Botha, who's the operations lead for the task force. As of today, we have given more than 113,000 doses of COVID-19 vaccine, which is more than 7% of Manitoba's adults. And because our supply is increasing, we are able to continue to expand our vaccine eligibility at our super sites and pop-up clinics. We've been making additions to the eligibility every day this week, including today. So I encourage Manitobans to check the website regularly for updates because changes are coming quickly. I do want to emphasize that all of the vaccines being delivered now are safe. We want you to take whatever vaccine is available to you as quickly as possible. This will help protect you, it will help protect those you love and others around you. I want to share something again that I had mentioned last week. Vaccines are by far the safest and most studied medical intervention in our healthcare system. We have systems in place to watch for any signals of any negative outcomes associated with vaccines that don't exist for any other medical intervention. I know that there have been some questions about AstraZeneca vaccine and links to blood clots in some European countries. However, we are not seeing that here. The version of AstraZeneca being used in Europe is not the same as the vaccine being used in Canada. We don't have the same batch. But even if it was the same batch, there's no indication that the vaccine has caused any of the adverse reactions being reported in Europe. And in fact, in the UK, where they've administered 11 million doses of AstraZeneca, they have not seen any increased risk of blood clots. Health Canada is in contact with European regulators, and they will take immediate action if there's any evidence that the vaccine increases the risk of blood clots. What I can say after having reviewed the European data myself is that the rate of blood clots in the European countries using AstraZeneca appears to be lower than in the general population. Yesterday, the National Advisory Committee on Immunization expanded its recommendations for AstraZeneca or Covishield to include people older than 64. Over the long term, this is great news. We want to have more flexibility about how we can provide vaccine to Manitobans. But right now, that doesn't change the fact that we only have 18,000 doses of AstraZeneca available. So for now, we'll be sticking with the current eligibility criteria and continue to make the vaccine available through doctors' offices and pharmacies. I want to encourage Manitobans to take advantage of the tools available to get more information about the vaccine so that you can be ready when it's your turn to be immunized. Today, we are launching a new campaign to engage directly with Manitobans and encourage COVID-19 vaccine uptake. This campaign, called Protect MB, is going to use advertising, outreach, and engagement to support our vaccine efforts. As part of Protect MB campaign, a new website also launched today. You can visit the site for information about vaccine eligibility, sites where people can be immunized, as well as stories about the vaccines and myth-busting information. People can also sign up on the website for regular email updates on the vaccine program. The site will have tools for Manitobans who are keen to get the vaccine so that they can share with their friends, their families, and their social networks. Please visit protectmb.ca for more information. A few final items that I wanted to share on behalf of all of public health. Today is St. Patrick's Day. Public health wants to remind everybody to connect safely and as much as possible connect virtually. We know we're seeing cases in the community and we want to keep all Manitobans safe while we continue to offer immunization as quickly as we can. With that, I would like to turn over to Johanu.
Thank you so much, Dr. Reimer. Good afternoon, everyone. I'm Johanu Botha, Operations Lead for the Vaccine Implementation Task Force. This week, we are continuing to make progress in delivering the COVID-19 vaccine to Manitobans. The super site at Selkirk is up and running and provided more than 1,000 doses last week. The super site at Morden will be opening on Monday. We will soon be expanding to another floor of the RBC Convention Center, further increasing the number of appointments that we're able to make. And there are still some spaces available at pop-up clinics as well, with more to be scheduled in the coming weeks. We are able to continue making these expansions because we're finally getting more vaccine. We are using Pfizer vaccine at super sites and with some focused immunization teams. We know Manitobans have had questions about how much vaccine we have and how many doses we've administered and how we manage our inventory of vaccine effectively. We want to immunize as many people as quickly as possible while ensuring safety, and that remote, rural, and more at-risk populations can be reached as well. All of our super sites served by Pfizer are able to administer all of their weekly supply in less than a week. But we do hold a minimum level of inventory at each super site to ensure the next week's earlier appointments can be kept if a shipment from the federal government arrives later in the following week. The approximately 20,000 Pfizer vaccine currently across our system will be used by March 23rd. Another 14,000 doses should arrive this week that will be used between March 24th and March 27th. And of course, we expect to see another shipment next week that we will begin to work down again right away. Moderna, in turn, is used for targeted populations in smaller volumes, so the inventory can take slightly longer to work through. We received 20,000 doses on March 12th, so there is now just under 30,000 doses moving throughout the system to our First Nation partners, our pop-up campaigns, and the Congruent Living campaign. If we do not receive any more Moderna doses, we will have moved through our non-First Nation portion of that inventory through our pop-up and Congruent Living campaign no later than the end of this month. Moderna is often separated into smaller batches that focused immunization teams and pop-ups administer in rural or remote communities. So both the amount administered by these channels compared to a super site and the transportation and setup timeline means the nature of us delivering an equitable service, often across long distances in the case of Moderna, will be longer. 18,000 doses of AstraZeneca Covishield has been shipped to medical clinics and pharmacies, and as of today, over 1,500 doses has been administered. Today as well, we're happy to announce that we are launching the province's new online booking tool to accept appointments online. This tool can be found on Manitoba's vaccine website and will use generally the same questions used on phone at the call center. Those looking to make an appointment will go through these screening questions to ensure they are eligible, and their confirmation that they are eligible will be saved in the system. We anticipate a large amount of traffic today and have a virtual waiting area to manage traffic volumes, so we'd like to thank people for their patience when using the site as we launch. As with the call center, only eligible Manitobans should be making an appointment online. Right now, you can only book super site appointments online. While you can't yet book online for the pop-up clinics, you can still phone for an appointment in a community near you. And of course, if you're eligible to get an appointment with a doctor's clinic or pharmacy, you'll need to contact them directly. We will continue to provide you regular updates on all our progress. Thank you very much.
Thank you. A reminder to our reporters, you will have one preliminary and one follow-up question. Up first this afternoon from CHVN, Taylor.
Hi, good afternoon. My first question is, now that we've got two different ways to book an appointment, how will overbooking be prevented?
That's a great question. Thank you for that. So there's two inputs into the system, but it's still the system underneath. So if once a slot is taken, whether it's by the call center or by the online process, that slot is held.
And there are some communities that are more likely to not get that vaccine at all. And with the province being so reliant on herd immunity, how is the province addressing things like vaccines no uptake in those vaccines in particular communities?
Well, I think there's a lot of things that we want to do to improve confidence in the vaccine. Certainly, there are some communities that are more reluctant than others, but even amongst the communities where uptake is very good, there's always individuals who, for a variety of reasons, choose not to be vaccinated. So the Protect MB campaign is just the first step in reaching Manitobans to try to get information about the vaccine generally, including the safety information around it and the effectiveness of it. We want to continue to communicate with Manitobans through things like this, where we have a chance to speak to multiple news outlets who can hopefully reach a large percentage of the population about the importance of being immunized and how safe and effective the vaccines are. And then our communications team is also working on further rollout plans to address any sorts of hesitancy that we see throughout the province. And we'll be engaging with stakeholders, with community leaders to ensure that we have mechanisms to reach a variety of communities within Manitoba.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. We've heard from many folks going to the convention center for their vaccination who are concerned that immunization tables, a number of them, are not staffed and the clinic is not operating to its fullest extent. Can you address those concerns and explain why it is that the clinic may not be running at full capacity each day?
So the clinic is running at the highest capacity it can, given the supply that we have at the RBC Centre, and we're staffing up accordingly. And we have the capacity to do so as more supply comes in.
Okay, thanks. And I think, Dr. Reimer, my second question will be for you. We're into the third stage of the priority populations by my read of previous documents. Can you please provide the number of healthcare workers who have been vaccinated out of those who are eligible?
Yeah, unfortunately, I don't have those numbers in front of me. It's also a very challenging number to get because it's hard to get an accurate count of all healthcare workers in all settings in Manitoba. So earlier on, when it was largely employees of regions or of shared health, we were seeing 70 to 80% uptake. Since then, I would have to go back to our surveillance team and see if we can get something more updated that reflects the larger groups of healthcare workers outside of those who are directly employed by either a regional health authority or shared health.
From Global News, Brittany.
Good afternoon, Brittany from Global. My first question is for Johanu, who you kind of addressed this in our tech briefing. But when we look at the vaccine numbers that even were just released this morning, it says that we have to date 113 plus thousand doses that have been administered, but we have a total of 179, almost 180,000 doses. And it looks like we're sitting on doses or tens of thousands of doses. How do you address those concerns from Manitobans that say we're not moving fast enough when it looks like we have enough to be going at a much faster pace?
Yeah, thank you so much for that. So the stats that you reference are the ones that's on our public dashboard, and it shows the total amount of doses that we've received and then the doses that has been administered. The reason there's a discrepancy between those two is the doses administered doesn't at this time include the thousands and thousands of doses that we've allocated to our First Nation partners and that they have administered. It also doesn't yet include all the doses that we have sent out through the distributor channel with our physicians and partners. So once those are included, that discrepancy will be minimal. I think one thing to keep in mind is the moment we have doses that arrive here, it shows as doses arrived. So you see that jump right away. The doses administered figure jumps up the moment that dose is entered into the public health information system. So it's the very end of the chain that you see. So the dose, a week in the life of a dose is a dose always moving, but it checks in right away when it arrives in Manitoba, and then it's got to move through its system. It's slower through our pop-up clinics and our congregate living facilities I had mentioned, much faster through our super sites, but it's only when at the very end of the line, it's not just hit an arm, but it's been entered into the system that it shows as administered. So there will always be a bit of a lag, but those two figures should be pretty close to each other once we incorporate the doctors and physicians and what has been done by our First Nation partners.
Thank you so much for that. And my other question is for Dr. Reimer. a lot of people have been waiting to know when first responders and essential workers might be able to get in line. Has any more thought been given to that, or any more answers that we can provide for people there?
Yeah, we've continued to do a lot of consultation with a wide variety of stakeholders, and we're now trying to focus in on how we can prioritize access for different essential workers. So some of the conversations that we're having with food production facilities, for example, is how we might be able to set up clinics in their own facilities to facilitate easier access for their employees. And so we're going to continue to work with the stakeholders within essential workers to try to remove any barriers for them to get immunized with the much faster rollout than we had initially been expecting, particularly as we're delaying the second dose. The biggest barrier for many essential workers will be just facilitating access, just getting to a site, booking, finding time to get off of work. So we want to work with them to ensure that we find ways to have it be as barrier-free as possible, so that the inconvenience of going to a site doesn't play into a decision of whether or not to immunize.
From the Brandon Sun, Drew.
Thank you very much. Based on the survey that the province did about people who want to get the vaccine, showing that 9% of people are skeptical. Can you comment on that number? Like, is that higher or about where the province would expect that number to be?
Yeah, so I mean, maybe the term skeptical is over-inclusive. So skeptical really indicates those folks who, for a variety of reasons, are not immediately stepping up for a vaccine. So it may or may not be that they're truly skeptical. It may be what other priorities they have, whether it's difficult for them to get to a location to immunize. So while we always recognize that there's going to be a certain percentage of Manitobans who, for a variety of reasons, will choose not to be immunized, we want to get that number as low as possible. So starting at the number you're saying at 9%, which doesn't come from one survey, it actually comes from a collection of data points that we've compiled together to get a broader picture. That's a great place to start. We know that we're going to see some hesitancy there, but we want to improve confidence in the vaccine. We want Manitobans to know that we are watching in Manitoba, in Canada, and in the world very carefully to ensure that there's no significant safety concerns about the vaccine, that it's effective, and above all, that it's going to reduce the likelihood of them having any serious outcomes related to COVID. So we're going to work hard at reaching that large variety of folks, whether it's because they're truly skeptical, perhaps because they don't speak English or French well, and so they don't have materials easily accessible to them. Perhaps it's because of geography, but whatever the reason is, we want to be working with communities to ensure that we can address their concerns.
Okay, thank you. And speaking of growing confidence in the vaccine, we're hearing from some groups that a multilingual approach is important to kind of reach different communities. So other than French and English, what languages is the province reaching out and providing vaccine info in?
I don't have the full list of languages with me, but I do know that our communications team is working on providing materials in a variety of languages. And so I would have to take that question to them to get the exact list, but I know that it's substantially more than just French and English. And we'll be working to get those materials out as soon as we can.
From CJOB, Skylar.
Hi there. Thanks for your time, doctors, this afternoon. I know we have a confirmed case of a variant involving a staff member at a Winnipeg care home, and I believe there's some test results pending for a resident there as well. Are we sure that all of the vaccinated staff members and residents will be safe from variant cases as well?
Yeah, so I have been notified that there is a case in a staff member at one of the personal care homes that screened positive, as well as a case in one of the residents that screened positive at the same care home. I don't have any of the details in front of me about that, but I am told that so far all of the testing for those who were potentially exposed to those individuals has come back negative, but that they're continuing to retest and work on that. But if you do want further details, I know that the WRHA communications team would have more information to share.
Okay, thanks for that. And I'm just wondering your thoughts on how you think things are going in terms of the AstraZeneca vaccine, since I believe there's less than 2,000 administered so far, and I know there isn't much to look forward to, at least as far as things are confirmed from the feds, but more than 50% of our province's shots do expire within a matter of weeks here.
Yeah, well, what we're hearing from the physicians and the pharmacists is that they feel confident that they're going to be able to use all of the vaccine that we provided to them. What we hear more than anything else is that we didn't provide them with enough doses. And on the task force, I would say we wholeheartedly agree. We wish we could have provided a lot more doses to each of those clinics and pharmacies, and in fact provided it to more clinics and pharmacies as well. So the shipments started going out late last week, and some of them didn't go out even until early this week. So the fact that we've gotten almost 2,000 doses injected and entered into our data system already is extremely encouraging. It means that the pharmacists and docs started administering as quickly as they possibly could, some of them the same day that the vaccines arrived in their facilities. So I have no doubt that this team that is spread out through the province is doing an excellent job at reaching Manitobans, and we really look forward to future shipments so that we can continue to provide Manitobans with a convenient location where they can go for their vaccine, as well as a location where there's that trusted health expert that they can talk with and review all of the concerns they may have about the vaccine. So overall, I think we've been really happy with the beginning of the rollout and expect that things will continue to go up as data starts coming in from those locations.
From the Winnipeg Sun, Scott.
Good afternoon to both of you. Scott Billick, Winnipeg Sun. Based on the survey results that you guys got in, it's around 81% of people that are in that kind of willing to get the vaccine range. You guys have put out projections for when the first doses could be eligible to every Manitoban based on 70%. Will those change now going forward, given what you know from that survey?
Thanks for that. It's a great question, and we could probably rerun our models to see what it does to that timeline at that high take-up rate. It probably won't change tons, it's about a 10% difference. So we're still looking, I think, generally mid-end May if everything goes well, and generally mid-end June in a less ideal scenario. But we can certainly run our scenarios to align with that kind of data to see what we get out of it. Yeah.
All right, thank you for that. And a question for Dr. Reimer. Dr. Botha talked about it earlier during the technical briefing, but I'm curious to know about safeguards for the online system. It might be easier to game that system than it would be a phone call, and I assume the last thing you want is people, showing up at a super site who have taken an appointment from somebody else, even though they're not eligible. So I guess, are there stricter safeguards in place for online, or how do you manage that?
Well, one of the things that people need to have is a personal health information number in order to use the online system. And since going forward, most people will be eligible based on age, that information is associated with your personal health information card. And so that's one clear safeguard as far as eligibility that will be part of the online system. It's certainly possible that people could mislead either the online system or the call center if they want to try to access the vaccine more quickly than they should be eligible for. But I have a couple comments in response to that. The first is that we think that that's a very small proportion of Manitobans. overall, we're hearing Manitobans are eager to get the vaccine, but also eager to make sure that those people who need it the most are getting it first in line. So if anything, we've had Manitobans who are stepping aside when they are eligible because they feel that other people are more deserving. And to those folks, I would say, we want all Manitobans to be protected so that we can protect each other, and we encourage you, as soon as you're eligible, to sign up. But then the second issue is that when people do come into our clinics, our super sites, our pop-up sites, we are asking for identification there as a second safeguard, not so much for people who are trying to mislead us, though it would be helpful for that as well, but just to ensure that we are providing healthcare interventions to the right person, that we know who we're treating, like we are when we're drawing blood in a lab and we expect people to show their health card so that we know that the person in front of us is the right person getting the right treatment at the right time. So those safeguards are in place at the clinic sites, but also ensuring that people do demonstrate their age through the sign-up process, and they also need to affirm that they're eligible through the process as well.
From CBC Radio Canada, Camille.
Good afternoon. My first question is regarding the online booking tool. Did you evaluate the possible virtual waiting time in the following days? And if yes, how long should people be ready to wait approximately?
Thank you for that, Camille. As long as only eligible Manitobans apply, we're not anticipating a long wait time at all. It's a question mark to see how that goes today once we've launched it. So I think we'll just reiterate, please only utilize the system if you are eligible.
All right, thank you. And also on the province branch website, the tool to find an immunization clinic is not working right now. So we're just wondering, when are you looking to fix this, since you encourage people to look up online to get information?
We will look at that right away.
From CBC Manitoba, Jill.
Good afternoon. We're seeing more of these variants of concern circulating. As we mentioned, now one case connected to a personal care home, indication of community spread. I'm wondering how that affects or changes the vaccine rollout plan going forward.
Yeah, that's a good question. Certainly, we are aware that the number of variants of concern in Manitoba is going up. I would say that the vast majority of the variants of concern we're seeing in Manitoba are the B117, which is the one first identified in the UK. And it does appear that all of the vaccines that we have so far work equally well against that variant as they do against the original variant. So from that perspective, we aren't really changing anything with the vaccine rollout in response to that variant. There is some decreased effectiveness, it appears, against the variant that was identified in South Africa. Though I do want to point out that the vaccines are still effective against this variant, even if the total rate might be a little lower. So overall, I mean, these are the vaccines that we have available to us. And seeing the variants in the community makes us even more eager to get more doses from the federal government and get those out to Manitobans as quickly as possible. But that's still the goal. And whether there's variants in the community or not, it's important that we remain focused on how we can reach Manitobans. Manitobans are expecting us to provide the vaccine to them in a way that's convenient and safe, and the variants don't change any of that.
Thank you. And my follow-up is just with respect to AstraZeneca and the 18,000 doses that have been sent to clinics and pharmacies, but only 1,500 doses have been given out. Can you explain that discrepancy?
Yeah, so we've sent the 18,000 doses out to just under 200 separate clinics and pharmacies, and they are each booking their own appointments through their own booking systems. They are contacting those who are eligible, We found out with very little notice that the doses were coming, so likewise they found out with very little notice that the doses were coming. And so, it was not possible for them to do a lot of pre-booking because we didn't know exactly when we would be getting the shipment from the federal government. So they are just now starting to book in those appointments. We know that many of the locations started putting needles into arms the day that the vaccine showed up in their clinics or pharmacies. And so, we're very happy to see that this rollout has started. The shipments from us started late last week, but some of them still went out early this week. So there's some clinics and pharmacies that have only just received their doses and started booking those appointments. And it also took them a bit of time to go through their patient roster and identify who are the folks at highest risk and who do they want to reach out to. The final thing that I'll say is that that for some of these facilities, there can be a day or two lag in between when they administer the vaccine and when that information gets into our reporting system. We have great agreements with all of them that they will very quickly turn around the data entry. But they're also busy clinicians, and this is not the only thing that they're doing in the clinics and pharmacies. They still need to meet the needs of Manitobans for a wide range of health concerns. So it's not like they're able to shut down the clinic and pharmacy and do only these vaccines and then do only data entry. This is a challenging situation for them to balance out the ongoing needs of their patient population along with this very urgent need to get needles into arms. So I guess to summarize all of that is to say that we're very happy with how many doses have been reported to us so far, and we feel confident that those numbers are going to continue to go up quite quickly.
From the Canadian Press, Steve.
Oh, hi, Dr. Reimer. This morning we were given some background briefing, and I want to touch on the data points that you received, both through the surveys and other methods. It looks like well over 80% of people have either been vaccinated or are keeners or are likely to get vaccinated. And I'm just wondering, are you encouraged by that number? Was it more or less than you expected?
Yeah, I think broadly speaking, when we talk about herd immunity, which is the percentage of individuals who need to be vaccinated in order that we can really as a community start to protect each other, even for those folks who are not immunized, that there's just not enough susceptible people that the virus can survive and continue to circulate efficiently. We usually with this virus talk about around 70%. Now, unlike things like measles, where we have decades of data to go on, the 70% is based on a lot less information, so it's a bit of an estimate. So when I see that over 80% of Manitobans are eager to get the vaccine, I'm really encouraged by that. If we can get 80% of Manitobans immunized, we're going to be in a completely different situation than we were this time last year. We don't want to see a repeat of what we saw in fall of 2020, and if 80% of Manitobans are immunized, I believe we won't see a repeat of that. Now, of course, this virus could surprise us. It's always changing. There's thousands of different variants, and so that's always a possibility. But that's an awfully great starting point if we can get 80% of Manitobans immunized.
And the minimum age for the general public to get vaccinated has dropped again today. It seems to be dropping by small amounts, but fairly quickly and regularly. Looking ahead, can you tell us, do you expect to drop it by a couple of years every 3-4 days kind of thing?
Yeah, we've been really fortunate to be able to keep dropping the age. I personally find it very exciting to see the number change every time I check the website. And so I anticipate that we'll be probably early next week, we'll be talking about people who are 65 plus. That's particularly important when we're talking about the AstraZeneca, because for these first 18,000 doses, we're not changing the age eligibility. And that was in part because we're expecting by next week that everybody, regardless of health conditions, over the age of 65 will be eligible through a pop-up site or a super site. And so that odd discrepancy of the two age eligibilities will disappear very quickly. But we just can't wait to announce every single time we get to decrease that age. And the more doses that come in, the faster we can do that.
From CTV Winnipeg, Michelle.
Hi, this question's for Johanu. I was wondering if you could just take us through what information people need if they're going to be booking online so they have it ready for them, and what the steps will be.
Thanks, Michelle. So your basic biographical information, of course, your name and your date of birth, and then your Manitoba Health number is what you need, and an email address. So those are the basics. If you have those things, then you should be off to the races to book online, assuming, of course, that you're eligible. And then in terms of the process, it's really just a virtual version of what you experience at the call center. So the same screening questions to make sure you're eligible, provide the same kind of information on where and when your appointment is. And then we maintain, there's a point at which that you confirm your eligibility, so that record is kept. And then, of course, at the end, you're given a record of when and where your appointment will be. So it should be that simple. That's basically what you need to book online.
Thank you. For Dr. Reimer, I know you said that the NACI recommendation isn't changing for the first 18,000 AstraZeneca doses. But going forward, is there any changes to the planning or the distribution for the pharmacies and doctors if they're going to be doing just anybody who's eligible?
Yeah, so for the first 18,000 doses, the reason that we didn't change, despite the fact that NACI did change their recommendations, is that those doses are largely spoken for. Manitobans rely on us to provide an efficient and convenient service. And if we suddenly go back to 200 different clinics and pharmacies and ask them to change course rapidly when they've already booked appointments, they've already identified eligible patients, and in some cases have already provided vaccines to individuals, that's going to impact our efficiency. That's going to impact how easy it is to understand the process. So it was really critical, especially as there were already more than 18,000 Manitobans eligible for the 18,000 doses that we had, that we not create more confusion in the system. That said, we are absolutely open to shifting to other eligible groups as we get more doses of AstraZeneca. I know there are individuals who are homebound, for example, and AstraZeneca is easier to transport than the mRNA vaccines, and so it could be a very good option for those folks going forward. We intend to connect with our partners, with Docs Manitoba, with Pharmacists Manitoba, to get feedback from the clinicians, because they're in such a great position to do an assessment to tell us what are the needs they're seeing in the community and who would really benefit from being able to come into their clinic as opposed to going to a super site. So we're going to start those conversations right away. In fact, we have started those conversations already. And we'll, when we find out from the federal government when the next shipment is coming, we can start to make some decisions. Because we don't know exactly when, we don't even know approximately when the next shipment of AstraZeneca is coming, nor how much it is, we can't really identify which group to target at this point, because we don't know who will already have been immunized, who's going to already be eligible at that point. But as soon as we have that confirmation, we will be taking the information we got from our partners and putting that together with the scientific data to come up with the plan for the next shipment.
Our final reporter this afternoon from City News, Stephanie.
Hi there, Stephanie Lasuk from City News. Just wondering what specific actions you'll take to reach that 10% of people deemed not reachable by the vaccine campaign.
Yeah, so I mean, we know that there's always going to be individuals who, no matter what we do or say, are going to choose for a variety of reasons not to be immunized. But that doesn't mean that we don't want to ensure that we are reducing barriers as much as possible, that we're connecting with folks to help provide them with reliable information about the safety and effectiveness of the vaccine. So we do have a communications team that is focused on vaccine confidence and is going to be working on rollout of a variety of different mechanisms to reach people who may be feeling hesitant about the vaccine, who may need materials to be translated for them, or who may just want to have easier access to questions and answers. So that work is ongoing. But we want to not only communicate broadly through opportunities like this, where we hope that all of the media outlets that we're talking to reach a large percentage of Manitobans, but also through the website, through other advertising opportunities, and in engaging with stakeholders and community leaders, because we know that those trusted community voices can make a huge difference in what people feel about the rollout and whether or not it makes sense for them to be immunized.
Okay, thanks. And I just want to clarify something you said earlier, that you're not finding people trying to skip the line and lie to get their vaccine appointments booked, but instead you're finding kind of the opposite, where people are a little bit hesitant to get their appointments booked because they want other people with higher needs maybe to get the appointments before them. Is this something you ever expected, and how are you going to combat it?
Yeah, I mean, broadly speaking, we're not seeing a lot of people trying to jump ahead. Certainly that will always be part of the picture, but most of the reports that we're getting back are either people excited and signing up when they're eligible, or folks who feel that, maybe they want their neighbor to get access first, or they want their parents to have access first. And so in the same way as we want to reach to people through a variety of mechanisms, including this press conference right now, for hesitancy generally, we would feel the same way when it comes to well-intentioned hesitancy. So we're asking Manitobans, if you're eligible, even if you feel that somebody else should be going first, we want you to be immunized so that you're protecting that person. The vaccines, we're starting to see data coming in that are making us more confident that being immunized not only protects the person who receives the vaccine, but also decreases the likelihood that they can spread to others. So you're not only protecting yourself, but you're helping us get towards that herd immunity, and you're helping us take a step to protect other people in your community, your loved ones, and taking a step towards being able to decrease some of the public health restrictions and getting to whatever our new normal will be. So please, if you are eligible, call or go online to book. We want to see you there as soon as possible. And we're going to try to continue to reach Manitobans through a variety of different mechanisms, including stakeholders and community leaders, to improve uptake.
And that concludes today's media briefing. Thank you.